to tell you a little story about myself. About when I was 6 years old. When I was 6 years old, I had met my grandparents on my mother's side, and loved them. And then I met my grandmother on my father's side, but I never met my grandfather. And I didn't think about it until I was 6, and I was like, at that point, for some reason, my mind was like, wait a minute, there's a grandpa on my mom's side, but not on my dad's side. What's going on? And so I asked my dad, and he told me this profound story that stuck with me and has really led the rest of my life. And he told me, well, your grandfather passed away when I was 12 years old. And I was like, whoa, that's only 4 years, or that's only 6 years. I've only been alive for 6 years, and another 6 years, that means my dad could pass away at 6. And so I was like, I didn't want that to happen. So I was like, hey, tell me what happened so I can make sure it doesn't happen to you. I don't want that to happen.
That's so cute.
And so he told me this story. And my grandfather, he grew up in Norway, immigrated as a child to the United States, and became a carpenter and built houses in Sioux Falls, South Dakota. A lot of his houses are still standing there. And was basically one of the pioneers that built that city up. And that's where my dad grew up, which was in Sioux Falls, South Dakota. And as my grandfather was doing this work, he decided he was going to chew tobacco. And so he'd chew tobacco, but my grandma was like, you know what, you are not going to be chewing this in the house, especially not going to be spitting it in the house, that's for sure. And so my grandpa was like, okay. And so he decided that instead of spitting it in the house, he could still chew it, but he would swallow it instead.
Oh no.
And as he was doing that, he started to grow cancer in his stomach. So the doctors went in, they cut out his stomach, and they said to him, listen, you keep doing this, and you're probably going to die. It's not going to go well for you. But what had happened to him? He had become addicted to this. He couldn't stop. And so he kept doing it. And within a few short years, he died from the stomach cancer when my dad was 12. And that story really stuck with me. And I decided then and there that I was going to make sure that I was going to help people, especially my family, so that would never happen to them. That was my little boy, limited understanding of how the world works, but I was going to do it.
I don't think it's limited. I think that's your limitless at that point.
Thank you. I think that's true. But everyone has I couldn't force anyone to not make decisions, right? Everyone has their agency.
Kids don't understand that though.
No.
That's so cool.
It's funny because I have grandkids now too, and they'll sometimes say things like, why is this person doing this or that? They should just not do it because it's gonna hurt them. And it's like, well,
You don't look like a grandpa either.
people have to make their decisions. Yeah, I have 3 grandkids.
Wow, crazy.
So, fast forward, 6 years old. The only way I know how to heal people is a medical doctor, so I'm going to do it. And that's always been my dream. And let me tell you, medical doctors, I think they're necessary. I think they're wonderful healers of this community. I have nothing against them at all. But for whatever reason, as I was going through college, it became apparent, and I kind of talked about this before, that being a medical doctor wasn't going to be the thing that I wanted to do. I wasn't sure why. And then I got the chance to be working with a chiropractor. I saw how he helped people without giving them any drugs, any surgery. I certainly couldn't help 100% of the people. I had to refer some of them out to medical doctors. But he helped so many people that I was like, wow, maybe that's something I should do. So I started looking into it, and I haven't looked back since. So I want to teach you a little bit about, I guess, the chiropractic philosophy, and a little visual. It's kind of a funny visual. I learned it from my mentor. But chiropractic is really about the spine and the nervous system. And how when you affect the spine, you can also start to affect the nerves that come out from the spinal cord. And the spinal cord goes directly to the brain. And so that information that flows from the brain comes down, comes out through the spinal cords. And if you interfere with that somehow, in some way, maybe we can get like a little short. It doesn't work like it should. So let me back up and kind of go over that again.
Ooh, we teach Alice's dad actually, that my co-teacher teaches, he wrote all these books about body electronics. So that's really cool because yeah, you get a short.
So let's start from the very beginning of our physical life, right? So we start out as an egg, right? An ovum, so a little dot. Much smaller than that, probably about the size of a pencil, sharp pencil dot. And eventually, another cell comes in, many times smaller, the sperm, right? And they come together, and that egg, it starts to vibrate, and it starts to divide. It divides, and it starts to become, starts to differentiate itself into a living being, into an embryo, right? And as this baby is forming, you got all the things starting to form. This is going to be, I am not an artist, but, so you have the spine that forms, right? And then you have arms, you have the legs that start to form, and then you have the heart, the heart that starts to form, and your kidneys, and the liver, and the brain, and then it starts to form this spinal cord, right? And then it starts to protect that spinal cord and the brain with bone. Because all that information for the formation of this is coming from that brain and that spinal cord. And so the body's like, hey, this is important. We're going to protect this. Because if that's gone, the rest of the body's not going to work. Right? This is all basic stuff, right? Coming down here. And you have, there we go. That's the sacrum. Little feet. And you have all these communications coming out to the heart, to the liver, to the kidneys, coming out from, I usually have different colors, but that's okay.
God
To
gives us
the,
everything we need.
Oh wow, look at that.
Ask and ye shall receive.
And yeah, all this information is coming from the spine to the arms, to the legs, to the reproductive organs, everything. Everything is being controlled from the master connection inside the brain. Right? It's all coming down. So we have this little embryo forming, those little babies, sorry. And but let's imagine for a minute that something happens, maybe in the womb, maybe right after birth, that causes one of these bones to become misaligned for whatever reason. Who knows? Maybe the baby dropped. Maybe there was some birthing trauma where the head got pulled and something got pulled out of place because the baby wasn't coming out. And these are delicate. So you tell me, let's just say it's right here. It goes from, yeah, let's say it's this one. And this is the one that's out of place, that bone right there. It goes to the kidney. Just think, just you tell me. If that nerve is being blocked that goes to the kidney, what's going to start happening to that kidney?
The kidney's not going to know how to act.
Probably grow.
It's not going to grow. Kidney's not going to know how to act, right? Why isn't it going to know how to act?
Because it stopped the
Information from the brain, right? Now, we have our physical body, and our brain says, hey, move that hand that way, wiggle your fingers, do it. But we don't have to physically think. We have an autonomic nervous system that functions and controls our kidneys, our heart, our lungs. We don't have to think, oh, breathe, right? We can go throughout life and throughout the day without thinking about breathing. We can think about not making sure that our heart's beating, that our kidneys aren't filtering our blood like they should, right? That the pressure in there and that the vessels aren't constricting or dilating like they should. We don't have to think about that, but our brain's doing all that work so that our body functions like it should. So imagine this baby, he's growing up, he's 6 years of age, goes to the doctor, and the doctor's like, hey, there's something wrong with this kid's kidney. It's not functioning like it should. You can give it some drugs and help push it along, get it to work a little better, who knows. But what ultimately is going to heal this?
Fixing the spine.
Maybe. Getting the pressure off the nerve though, right? You've got to get the pressure off that nerve. And that, in a really condensed nutshell, is what chiropractic is all about. Is that when you have one of these areas in your spine that is putting pressure on a nerve somehow, that's what we work on as chiropractors, is to open that up and allow that communication from the brain to the rest of the body to function like it should. Now, I love working with massage therapists. They are some of the best adjunct group of people that I work with as a chiropractor. Because not only is it just the bone that could be out of place putting pressure, but also it's the muscles, or the muscles pulling the joints out of place, or the muscles congesting the area so that blood is not able to move out of the area, which is called inflammation.
Oh.
Inflammation, right?
That's funny.
And then you get inflamed, and what happens when you have inflammation, a congestion? Then you get toxins that start to build up. Your body's not able to clean it out like it should, and that can start to burn and chafe on the nerves as well. So that is where massage therapist. Sorry, that's my phone. I apologize.
It was one of my kids.
Sorry, sounded excited.
Yeah, right. I should have turned that off. But that's where massage therapists can come in as well, because if you're not already, you will be adept at releasing muscles, muscle contractures, finding that swelling and allowing it to be released, finding that scar tissue from old injuries that have built up and have contraction or have locked these joints into place. And be able to break up that scar tissue and allow the joints to start to move freely again and allow the person to start to heal. So I love working with massage therapists. I refer people, you can ask Christina, we've referred many people to her.
We are a healing team. I think that we're all needed, all of these different aspects, and to be able to be abundant and say, they need you, they need me,
Yeah.
let's help them together.
So that is a really basic thing about chiropractic. Now I wanted to get into a couple other things, but does anybody have questions at this point at all?
I would like to, while we have this up here, I would like to know from your point of view why, because my C1, like that very, very, very top cervical, that always goes out since I was in high school, and it has such a hard time staying back in. And so I know that I need to be doing stretching and I need to be doing massage and things like that, but can you explain why that goes? And I know that, body mechanics and stuff like that matters too, but
Yeah, it all matters, but
spiritually and physically, I'm wondering
as you get into more about chiropractic and the philosophy and the things I've learned, C1, so I'll start from the basics. It is the way that it moves. Hey, let's look at it.
This is so great to have it right here.
So this would be your head, right? Your neck, your mid-back, your low back. And your C1 is a unique joint because it's right below the occiput. And it's where the majority of the rotation of the head comes from, right? It also will move back and forth for nodding as well. There's very little laterality from side to side. That's more for the lower ones, but there is a little bit there. But when you have an injury, so we're starting basic, but we'll get into some other things too, like the
And
spiritual.
I
like you
landed
said.
on my head when I was in 8th grade. I did a back tuck and forgot what I was doing halfway through and just landed straight on my head. So
Yeah.
that would be the injury.
Well, yeah.
Pressure on you probably came backwards as well against it.
Ouch.
So it rotates very well, and maybe you were looking and trying to see where you were going with your head turned when you landed too. I don't know, but I imagine so. And the reason why is because when this C1 is turned and then it goes through a sudden trauma, it is very, very vulnerable to injury. That's why people who, if they're looking straight ahead and they get a car wreck like that, they're going to have some damage, but that C1 usually doesn't get damaged. But if they're turning and they're looking and all of a sudden they get a whiplash, that's where we see the C1 start to get hurt, because it doesn't move side to side like it's supposed to. And so you have your head turned and then all of a sudden you whiplash that way and you start to, it rips this way and you get the tearing there, right? And it tears the ligaments. The body tries to heal with scar tissue. Scar tissue is never as strong as the original tissue. And then the scar tissue winds itself with a lot of pain receptors. And so then as you try to move it, it's less mobile, and you try to move through it, it hurts. Ow.
Migraines, headaches.
It starts to cause headaches, the muscles around it get tight, the body doesn't want to be in pain. That's level one. That's probably the most basic thing. That's probably what started it. And then, but emotions also. Who here has ever had an emotion where they just tried to bury it? I have. Right. Your body or your brain doesn't let you bury it. It'll express it in some way, and it'll always go, from what I've learned, to the weakest area in your body. And so it'll go back to that C1, and you'll start to feel it again. The muscles will start to get tight. That anxiety, that buildup, it all starts to build up in that weakest point again. And then if you don't have it,
Cool. Not full of interest.
Interesting.
yeah.
It's all messages too.
Yeah. So I always tell my patients that an injury that they've had in the past, even if it was when they were a kid, it never leaves you. Just like you cut yourself or you have a scrape on your knee, you're always going to see that scar. Because scar tissue just doesn't go away. It's not the way the body's built. And that scar tissue happens deep inside of us as well if we hurt or rip something. And then, what is the other thing our body wants to do? It wants to be the same, called homeostasis, right? It wants to go back to what it's used to, even if it's not good for it.
Mm-hmm.
And so we have to train it as well. We have to train our physical bodies how to move properly again. We have to train those deep intrinsic muscles how to support the head again like they should. And then we have to do emotional work to make sure our emotions that are causing these problems are being dealt with mentally and then spiritually, because if you're not strong spiritually, if you're not doing the right things spiritually, it's going to cause eventually, as we believe and as we know, it's going to cause like anxiety. It's going to cause us to not feel right. Depression, all those different types of things. It's going to manifest, and then we'll have the same problems again. And I'm not saying that that's all happening for you, but it has to be unwound. This is something that you've had since you were a child, and then your body's been trying to compensate it for the remainder of your life. And these last, I don't know how many years, 5, 10, 15 years, you've been working on that to unwind it, and it's not going to be unwound like that. And like I said, your body's going to want to go back to what it's used to.
The natural man.
That's right. So that's a great question. That's a really long-winded question to your question. Answer to your question.
My favorite kind of windy answers. What were you going to say, Katrina?
You know, it brings me back to one of the modalities that I learned becoming a massage therapist was cranial sacral therapy.
Yeah.
And so when you do release those restrictions, people will have actual unwinding where like their bodies uncontrollably are trying to unwind themselves. It's really interesting
Absolutely.
to watch and see that.
This is my awesome massage therapist, Katrina. He gives out your cards.
Oh, do you? Good.
And
We need to get you more.
how many of you have been able to massage somebody? Anybody? A little bit?
A little bit.
A little bit?
Just to
You will,
include our
as you go through it, if you haven't already, and I'm sure you both have, is you'll start massaging somebody and somebody will just start crying.
Emotional.
And
SES.
sometimes they'll even apologize. They'll be like, I don't know why this is happening. I apologize. I'm sorry. And as a healer, just be there for them. Say, hey, it's okay. Happens sometimes. Just let it go. Cry the whole time.
Those
It's not gonna
emotions
bother
have been
me.
trapped for so long.
Absolutely. Because you're opening up these areas that the body has, these emotions have been being stored, that they've been, and you're releasing that. And you'll release things where people feel like, oh my goodness, I am so sore here. I've never felt this kind of pain before. It's incredible. Well, if you dig into that a little bit, they have felt that pain before. And it's part of their body unwinding again and healing finally from an injury that they've been dealing with and covering up and ignoring for a month, a year, 10 years, 50 years, whatever it is. So don't be afraid of that either. Sometimes as healers, we want to heal somebody, we want to touch them, and we want to release something and be like, you're all better, you're perfect. And that's just not how the body works.
We've been calling it a healing crisis, like when you're emotionally or physically like in a healing crisis, like when you're detoxing, like you're letting things go. It's part of that unwinding process.
Absolutely. And so, just as part of my practice, I'll always tell people, you may feel worse before you feel better. And then they'll come back and they'll tell me, and they'll be like, for the last 2 days, I've just been in more pain than I can imagine, but now I'm starting to feel better. Now it's starting to go away. And believe me, as a young practitioner, seeing patients, they'd come into me the next day and be like, I feel worse than I did before. And my anxiety would go through the roof. I'd be like, oh my goodness, what did I do this time? Right? But it's not. That's how the body heals sometimes. Sometimes you have those miraculous things where people stand up and they're like, wow, I have not felt this good in a decade. What did you do? Cherish those. Write down your journals. They'll be important things for you to look back on.
Right.
To remember what you do, to remind yourself. Because that is not going to be the case all the time.
The way that I have learned to teach over this last couple of years with my clients, and well, I'll be teaching you guys, and you can, of course, you all take what is for you and do things in your own specific lit up way. But instead of just saying, okay, now make sure that you drink lots of water and stretch, or like, I love for people to go to the chiropractor and then come get massage and then go back to the chiropractor. I think that there's so many physical things that we can do. But if I know that they are recovering from, like we're looking at like their childhood abuse type things, or we're looking at, or even an injury that has been there for so many years that's physical, it's also connected. And so I'll ask them to journal, to write things down, and to, when they are feeling worse, when that does come, to invite the Savior in, to have him help with that, to not be alone in that, to invite their angels in over that next couple of days, so that they're not just miserable and on their own, because they're never on their, like, the kingdom of heaven is within us and all around us, and heaven wants to help. So that's, instead of course you do need to drink water and stretch, but sending them home in that pain, like just letting them know, use your angels, like tune into heaven, let them help you on that.
Yeah. And that's why I love what you do. As a chiropractor in my clinic, I don't think there's a patient that comes through that door that I see that I'm not saying a little prayer over every single one of them. because spirituality, Jesus Christ, is an integral part of my life. And sometimes I have the ability to talk to them about that a little bit. I think as a massage therapist, if your clients are open to it, or if you feel like you should talk to them about it, you have a much greater space of time to be able to do that. Sometimes I don't have a whole lot of time.
Some sessions into
I don't think I've ever seen a massage. As a massage therapist, maybe you'll see 5, 10, 15 patients if it's a really busy day in a day, and I see about 100 patients a day.
Wow.
Whoa.
So it's a little bit different. It is a little bit different. But I will say that if you have a patient who comes in and you're releasing something and you know you got it, and that keeps coming back, send them my way. Send them to a chiropractor. Because many, many times it's because that joint underneath is locked up and that nerve is impinging on the ability of that muscle to relax.
I've never been to a chiropractor.
I've never had an adjustment.
We will have a field trip.
Okay.
Because it's a beautiful, we're all on the same team, and sometimes you need that different angle, like the team member coming from the other angle.
Absolutely. Absolutely.
Field trip.
As you heard earlier, I adjusted myself. I was like,
Yeah, I saw a couple of you doing that. That's okay.
He does better, but
Anyway, that is basically my presentation. But does anybody else have any other questions at all?
I'm a little bit curious about fusions because my mom just had a fusion.
Like an
along with
infusion, is that what you mean?
Well, spine fusion.
Oh, surgical fusions.
Mhm.
Yes.
So is that like my mother-in-law? She also had a fusion. Now her kidneys are starting to fail.
Are they really?
But she's got a lot more other medical things going on. But
Yeah.
so is that gonna be pinching, or when they fuse, or do they find ways to get the nerves out? I mean,
They try. But you think about a surgery, to get to that spine, you have ligaments, then you have muscles over those, then you have some more muscles that are supporting around it, then you have the big muscles,
the rector spinae and
and the paraspinal muscles, and then you have the skin. And to get to that, you have to cut through all that. And then how does that heal again? Who knows? Scar tissue. Scar tissue. What does scar tissue do?
restrict and
It restricts it. Over time, it also does what? If you've ever had a scar, it starts to wrinkle up over time. It always shrinks. And it starts to constrict things more. So, they've gotten, when I first became a chiropractor, it was a little bit different with fusions, but they have gotten better with them over time. But they basically cause that the joints don't move anymore, right? That's what fusion means. The person still has to be able to move. And so these other joints that weren't moving quite as much have to take the brunt of that and have to learn how to move more. And that can make them more vulnerable because for their whole life, it hasn't been moving like that.
That does not sound fun at all.
yeah, I know. So I've seen so many people with fusions, and I just want to help them, but like
let's do
there's
all
And
the
like I
other
said-
things first.
Like I said, sometimes it's necessary.
Mhm.
I've absolutely had patients where I was like, let's try this. Let's give it the old try. And I work hard on them, and they're not getting better. They're not making a change, and then they decide they're going to do the surgery, and all of a sudden their pain's gone. They feel better because maybe the disc was totally blown out. There's only so much we can do.
Yeah.
Right? There's limitations of matter. That's one of the philosophies of chiropractic. There's a limitation to what matter can do. And if it's totally destroyed, it doesn't matter how often you massage it, you release all the muscles around it, it's not going to heal like it needs to. And sometimes there has to be some surgical intervention for there to be relief.
While you have that up there, can you just give a little brief, like the TCL
Sure.
in a more, I was going to say the TCL things, but you can say it in a more professional fashion.
Just like anatomy?
Yes.
Yeah. So your C1, C2.
And the cervical, that C stands for cervical.
Oh yeah, I'm sorry. Yes. So you have your cervicals. You also have, above that, you have your occiput, which is part of the skull, but it also has some motion to it too. And
Which if you guys want to all feel behind, you can feel your occiput like that.
yeah,
Occipital ridge.
yep, right back there. Then you have your suboccipital muscles. And for your headache patients, that is going to be a powerful, powerful area to release those muscles. And you'll see that it doesn't help with everyone, but it helps with a lot of them. Then you have your C1, your C2, which has the dens where the bony protuberance that comes up, where the C1 rotates around. C3, C4, C5, C6, C7.
C7 is usually that big one with the bump. You usually
C7 or T1, yeah.
Yeah.
They both kind of have that protuberance. And a lot of people will come in and they'll say, oh, I don't like how this is getting bigger. Well, guess how that happens?
Bad posture.
Bad posture. Or what does everybody in our society do? What do they have in their pocket? Cell phone. What are they doing all day long? Right?
Bone posture.
Right? Or they're on the computers like this with their head forward. You know, that great looking posture that everyone likes. Looks really good on you. And then you come into your T's, which stands for thoracic. And it's funny because as a chiropractor, I learned about all the neurology and what all these different nerves that come out and go to. And C5, C6, those are what we call a transition zone of the neck. And if people start having issues with pain, numbness going down their hands, it's coming from that C5, C6, sometimes C7 area.
Kind of like thoracic outlet syndrome.
Thoracic outlet syndrome is a little bit different,
Oh,
actually.
okay.
Yeah, that's lower. That's your T4, T3 maybe.
So it could be that and not just carpal tunnel.
Absolutely.
Yeah.
In fact, I would
Which
say
one is it?
C6, C7 are the carpal tunnel ones. C5 is also, can be into it though. And then T1, T2, T3, T4, T5. T1 through T4, T5, those are the main nerves that go out to not only your heart, but your lungs, your chest muscles, your esophagus, stomach, C6, C7, T6, T7, T8, T9, T10, your kidneys, liver, diaphragm, T11, T12, more of your kidneys. And then you start getting into the intestines as well. L1, L2, large intestines. L3 through L5,
And that's lumbar.
lumbar. Lumbar. L1 through L5 is lumbar.
What's the C one called again?
Atlas. So Atlas axis are the top two. Atlas, just think about it, it holds the world, or holds your head, as in the mythology, right?
That never clicked for me.
And then axis, think about an axis of rotation. That's where your C1 rotates around. Or it's just C1 or C2.
Very cool.
Circle 1, circle 2. And then L1 through L5, you have 5 lumbars, just the same as you have 5 cervicals. And then, who talked about craniosacral therapy? You get into that a little deeper, and it talks about how that L5 and C5 correspond, L4, C4 correspond, L3, C3. Yeah, there's a lot of stuff. So it's all, you can get really deep into this. That's not my job in here to do, is to get deep into it. But then you start to get into the L4, L5, and the sacrum, and then you start getting people who have the sciatica, the pain down their legs, foot drop, they're not able to walk like they want to. And again, that's a transition of L4, L5. Those are going to be the areas that people hurt the most, because it transitions from the sacrum to the lumbars. And then so these are the big areas, L4, L5. Down here in that small of your back. Somebody has low back pain, that's where it's going to be 99% of the time. T or thoracic 5, 6, and 7. That's a transition zone where it kind of goes from what's called kyphosis, or the natural curve backwards of the spine, and lordosis. I'm sorry, I got that backwards. Kyphosis is where it comes forward. Lordosis is where it comes backwards.
That's cool.
I always gotta kind of think about those ones, just to remember.
Sorry.
Yeah,
Show us scoliosis.
but that starts to transition into the kyphotic, so that T5 through the T6. So those are always going to be areas, these transition zones, C5, C6, T5, T6, L4, L5. Those are going to be the areas that you're going to find the majority of the problems. Or if they've had a car wreck, or they've landed on their head, C1 or Atlas, and those suboccipitals, especially if you have chronic headaches. Those are areas that you can work on.
Lower lumbars to release that. You'd be working like the QL and that's quadratus lumborum and into the SI joint, and so you want to release that pull on those lower, and that's where you can help with the sciatica.
Very cool.
Yeah, the sciatica, and then you have the piriformis muscle that runs across your gluteus maximus and minimus, medius, but the piriformis is a big one because if that's spasming also, that'll pinch on the sciatic nerve because it runs right next to that sciatic nerve. Sometimes, in a few percentage of people, it actually pierces the piriformis muscle.
Oh my gosh.
I didn't know that.
Piriformis is I feel like it's like a swear word. My clients who know that, who know what their piriformis is, I'll show you guys what that muscle is across the glutes, but it causes a lot of problems.
It's me and you want to stick your elbow in.
So that's actually what got me into massage. I'm grateful for the pain that I've had, for the injuries that I've had. I feel that exact same way about like the abuse and like the hard things that I've had in my marriage. I'm grateful for the injuries because that like landing on my head and having those headaches and migraines, even though it was so hard in junior high and high school, my parents tried all different things for me. They took me to different doctors. They tried so many different things. I had x-rays, but they didn't know about like massage and chiropractic until they had somebody. I think that we tried chiropractic and massage at my senior year in high school, and it made all the difference in the world. And so that having regular chiropractic and massage, I don't get regular migraines. I can stay on top of it. I don't have to have a life where I'm taking a pill that says the migraine medication says may cause nausea, and then the nausea medication literally says may cause migraines, and just be in that cycle of lose. You can listen to the body when you're in pain and do something to make the change. So that made such a difference for me. So I'm grateful that I have been able to find those answers because I've been able to use those things to help so many other people, like physically, emotionally, spiritually. I think it's all part of my personal like missionary training centers to like learn these answers for myself, to be able to create maps and build bridges and be able to help other people to live their happiest and highest life.
Thank you.
Thank you so much for coming today.
You're welcome. I hope it was some benefit.
Yes. Thank you.
Thank you. Can I have your kids take a picture of us with our awesome chiropractor friend today?